Welcome to the Tortoise COVID inquiry. We are trying at the end of what's been a year like none that we can remember to make sense of it. The Tortoise COVID inquiry is that definition of slow news, a measured and slow attempt to try and understand exactly what's happened. I should be clear that we're not trying to host a judicial review or a public inquiry. Frankly, we don't have either the authority or, as you may have guessed, the formality for that. But I suppose a lot of us have felt in 2020 that we're living in the blur of history as it happens. And it's been quite hard sometimes to try to understand exactly what's happened. And so we've set out to host what is in effect a journalistic exercise, one that tries to answer those very fundamental questions of journalism: who, what, why, when, who made the decisions, what really happened, why did those things happen, and to give ourselves a timeline of it, when. And the aim over the next 3 Fridays is to look at the response to COVID-19 in the UK in 2020 that will produce, in the end, a tortoise file that gives some sense of the difference between, if you like, the official reality and the real reality. We've been helped enormously by many of you joining us this morning, by countless more people who sent in evidence over the last couple of months as we've been seeking evidence and gathering data, and my colleague and fellow editor Giles Whittell has been marshalling those dossiers so that we've got a depth of information that sits behind the conversations and discussions we're about to have. And the aim, I should also say, is that we're trying to host it in a spirit of inquiry, to try and understand the answer to these questions. And there's a temptation, no doubt, everyone who joins us this morning will have to do one of 2 things, I suppose. One is to howl at the moon, to rant against what happened, to assume that everyone's either incompetent or self-dealing, or to swing in the other direction and have a certain generous fatalism and say this was good people doing good work in the most difficult of circumstances, and we should be understanding of the mistakes and errors that have happened. We're going to try and chart a course through that and actually try to understand exactly, as I say, who, what, why, and when. And in that, we're going to be helped by 2 sets of people. In the first instance, we're incredibly grateful to Nazir Afzal, formerly of the Crown Prosecution Service, and Joshua Rosenberg, known to many people for his broadcasting, but a QC, of course, as well. And these 2 lawyers are going to try and help us set out, if you like, the case for the prosecution, the argument against the government's handling of COVID-19. Nazir is going to take up that cause, and the argument in defense of the government's handling of COVID-19, and Joshua Rosenberg is going to take up that cause. Like all good lawyers, they're taking the brief in good faith and will speak to it. What they actually believe, of course, we may never know, or in fact we may know, but possibly not in the course of this inquiry. So they're going to frame it for us, and the reason we're doing that, and I say it with a smile, but it was a serious amount of thinking has gone into this, which is just gathering a patchwork of evidence is not as good as actually addressing the arguments for and against. And we wanted to do that in a way that, given the government has set its face against holding a public inquiry at this time, we weren't just making the case for the prosecution, we were hearing the case the government would make itself. And so we're going to make sure we hear evenly from Nazir and Joshua. And then we're going to go and try and patch together some of the key information and key points of view on this. And we're very lucky that we're joined by Paul Ormerod this morning, who's an economist at UCL and focuses in particular on decision-making uncertainty. We're going to go to Supriya Garikapati, who is at the University of Liverpool, an economist, and give us a sense of the broader economic picture, Supriya, but also what's happening and what's happened in Liverpool. And David Heyman, who has a particular expertise in this, in that he was at the WHO and leading the global response to SARS, and so has a little bit of knowledge about how governments do and don't respond to pandemics. And then I'm joined by my fellow journalistic colleague, the economics editor from Sky News, Ed Conway. This is a process in two parts. Tortoise is running its inquiry over the next 3 weeks, and Sky is going to pick up and run a review of 2020 in January. And so we're delighted that Ed's joining us to give both his perspective on it and raise the questions that need to be answered as we turn into the new year. So forgive the long and slightly lengthier introduction than usual, but I hope it frames and explains what we're doing. The first question is a stand back question. It's actually an attempt to assess whether or not our starting point is a fair one. The starting point that the UK's performance, both in health and economic terms, has been as bad, if not worse, than any other country in Europe, and whether or not that perception of ourselves is fair. And so we start with the question, the UK, how did it fare? And with that, can I turn over to Nazir Afzal and hear, if you like, the case against the government on how the UK fared. Nazir.
Good morning, James. Good morning, everybody. A House of Lords committee concluded last month that the UK's response to the pandemic was, to quote, hampered by over-centralised, poorly coordinated and poorly communicated policies and the sidelining of local providers. In a career of prosecuting some of the most serious cases, I've had to rely often on what we call circumstantial evidence, where you don't necessarily know everything, but you're able, through a jigsaw puzzle, to identify the bigger picture. Often, and probably more often, I was able to directly prove guilt because I had more than that. That's what we have here. We have a situation where government was woefully underprepared. Its response was made up on the hoof, poorly communicated, and failed to take account of what was happening elsewhere in the world. The UK has recorded over 70,000 excess deaths, and at various points has had the worst per capita death rate in the whole world. The OECD predicts that the UK will have suffered the worst economic hit in Europe. Research carried out for Tortoise, the UK has the fourth worst number of excess deaths amongst countries whose data was available in the quarter ending at the early autumn. The pandemic also revealed and reinforced existing inequalities. I've spoken to NGOs who talk about the tens of thousands of calls they've received in relation to domestic abuse, for example. Other data shows that benefits claims would peak to 15-fold increases on normal levels. And during the first lockdown, 1 in 4 schools were barely able to provide any teaching at all. In terms of daily confirmed cases per capita, Scotland managed to suppress the virus quicker than England and Wales in May and June, but all 3 nations have followed basically the same trajectory, although there's a lot to be said about the different levels of leadership. We look, for example, at the preparedness, given the Deputy Chief Scientific Officer told us that we were world-class in our preparedness. We didn't only see how poor the availability of PPE, how some of it was unfit for purpose, how that itself may have impacted on the decisions taken about when lockdown was instituted and what form it would take. We recollect, do we not, conversations about herd immunity playing its part in this government decision-making, whether or not the cabinet committees, whether SAGE was effective or not, whether the right people were on SAGE, whether the scientific advice was being followed. We also look at the legislation that was prepared in this pandemic and the questionable nature of the scientific evidence and the advice and the measures that led to most of the legislation that we saw. And throughout, there have been concerns about the role of Parliament and whether or not it had any role at all. You know, what was the communication strategy? I don't think there's anybody here that would say that the communication strategy has been anything better than poor. Then there's the issue of outsourcing and the various allegations of corruption, or at the very least, favoritism, which has led to enormous sums of money being paid often to organizations and companies which did not even exist before the pandemic started. The ability of the public to comply with lockdown, the way the lockdown was policed, The way that Dominic Cummings, the former special advisor, was able to travel up the country with COVID, and a ring of steel was put around him by the cabinet. These are all issues that reflect upon the government. This government and the way it's dealt with the financial arrangements. We'll touch on the economy later, how it is that individuals weren't supported. A sizable number, something like 3 million people were excluded from any funding whatsoever. The government support for the arts, the culture, the sport, the public life needs to be investigated. Look again, can you think of anybody that says anything positive about the leadership we've seen in that area? We must also look at the direct consequences of the pandemic, the loss of life in hospitals, the lack of capacity in intensive care, the fact that individuals were taken from hospital into care homes without testing, some of them dying, many of them dying at home because of the lack of community services, including my brother. In dribs and drabs, we've learned about the highest vulnerable groups receiving little or no attention, people from BAME communities who are suffering disproportionately, and yet we're still months on trying to find out what the government are intent to do about that. We'll later touch on test and trace and the program there, where there was a battle between science and politics, and whether expert advice really did shape the government's response. Were lessons learned from the first lockdown when we look at what's happening now? Did the announcements of things like moonshot and world class mask the inability of this government to deliver on the basics? On the 27th of April, 2020, in a speech at Downing Street, the Prime Minister said, "I know that there will be many people looking now at our apparent success. Yet there is a stark gap between the ambitious metric, those words, and the appalling reality of how this government has dealt with the pandemic."
Nazir, thank you. I'm going to turn to Joshua to hear, if you like, the case that he makes in defence of the government, and then, if I might, I'm just going to come back to each of you in turn. Joshua.
Well, James, you've asked me to put the case for the government. That's very kind of you, I'm sure. I regard myself as a journalist rather than a lawyer. I'm only an honorary QC. I'm not a barrister. I'm not bound by the cab rank rule, which says you have to pick up any brief that comes your way. But I do support the idea behind it, which is that everybody has the right of reply, the right to be heard. And if the government won't join you today and speak up for itself, I think it's important that it should have a hired hand to speak up for it. These are, to the best of my knowledge, some of the views that the government would put if it chose to. My starting point is, as you hinted in your introduction, we did our best, we did what we could. Mistakes were made, many mistakes, but ministers were acting in what they saw as the best interests of the nation. The government had an action plan. It launched it as early as the 3rd of March. It involved a 4-part strategy: contain, delay, research, and mitigate. At that point, coronavirus wasn't a pandemic, but the government was already talking of asking businesses to consider more working from home, less unnecessary travel. It mentioned social distancing, in quote marks, to delay the peak of the outbreak. At that time, the advice was wash your hands with soap and water for the length of time it takes to sing Happy Birthday twice. This, we were told, was the most important single thing that we could all do. That was wrong. The most useful thing I think we could have done was to wear a mask, but we didn't know that at the time. People who wore face coverings were regarded as eccentric or coming from the Far East or whatever it might be. We didn't know that we were safer in the open air. We didn't know, as we've been told in the past few days, open a window if somebody comes and visits you at home. There was a lot that we didn't know. So the Prime Minister took advice. He took advice from scientists, which was the right thing to do. He took advice from Dominic Cummings, which I think we can now say was not, and it took him a while to realise that. But there we are. The questions we're discussing in this opening session, as you say, are how did the UK fare, how did the UK compare, and how did the 4 nations of the UK compare? You at Tortoise Media have very kindly provided me with a few statistics, which I'll go through before dealing with some of the points that Nazir has raised. The first is the UK was not an outlier. Infection and death rates were bad, but not the worst. They certainly remain among the highest in the world, but as of mid-November, deaths per capita are nearly 40% lower than in Belgium, lower than in Spain, similar to Italy, France and the US. In terms of cases per 100,000, the UK ranks 17th in Europe after Switzerland, France, Netherlands, Austria, among others, and with fewer than half as many as Belgium. And little was known for certain about the virus in the early stages. It was a virus that nobody had ever seen before. It was not known whether infection conferred immunity. It was thought that reinfection was rare. Ministers were following the science, but the science was slow to catch up. On the 20th of January, China confirmed human-to-human transmission, and the World Health Organization said the virus had pandemic potential. But over the course of that month, the UK government's science advisors raised the threat level from very low to low. And it wasn't until mid-March that advisors studied lockdown options. We didn't model it because it didn't seem to be on the agenda, one of them said. But when the advice changed, the policy changed. In March, middle of March, Professor Neil Ferguson published a report warning of up to 500,000 deaths if the virus was allowed to spread unconstrained. That was similar to the government's own pandemic modelling committee. There was a delay in lockdown that remains controversial, but broadly speaking, according to Professor Mark Woodhouse of Edinburgh University, the government had been consistently responsive to changing facts. Now, Nazir has very kindly complied with the normal rules of disclosure by letting me see his notes in advance, and I'd like to respond to some of the points he makes. He began by quoting from a report published last week by the House of Lords Public Services Committee. I hadn't heard of that committee. Was its first report, and as he says, the committee found that the overall public health response was at times hampered by over-centralised, poorly coordinated and poorly communicated policies that were designed and delivered by central government, even though local level providers were often better equipped. That's an extract from the report summary, and it's part of a paragraph that says the UK's public services had entered the pandemic with low levels of resilience. But it's also worth reading the opening paragraph of that summary, and this is what it says. The COVID-19 pandemic represented an unprecedented challenge to the United Kingdom's public services. This report describes how service providers responded. Some of the responses that witnesses described to us were prompt and successful. At the national level, the NHS rapidly upscaled its acute care capacity with the construction of Nightingale hospitals. At the local level, 15,000 rough sleepers were safely rehoused. Many public service providers developed remarkable innovations to meet the challenge of COVID-19. Decisions which before the pandemic took months were made in minutes. Good personal and organisational relationships broke down long-standing barriers between the statutory and voluntary sectors. New ways to deliver services flourished. Digital technology was used more widely and more successfully than ever before. And the Lords Committee, just to finalise on this point, the Lords Committee makes a number of recommendations for improvements in public services so that they can hold on to the advances that they made. Now, James, I've got plenty of other points in response to Nazir's specific questions, but why don't I hand over to you, just in case you want to take the discussion in a particular direction.
Well, I'd like to, if I might, just follow up with a couple of questions for you and Nazir Reach. I was going to start, if I might, just by going back, Nazir, to the point, just to raise the point that Joshua made. One is, look, if you look at the numbers across Europe, if you just take the question in front of us for this session, which is how did the UK fare? Let's assume that Belgium is an outlier, but actually if you look at the similar sized economies and countries in Europe, the UK may have fared a little worse than some, a little better than others, but actually, as Joshua says, Italy, France, etc., they're pretty similar performances. Doesn't this just tell you something about the force of this virus more than it does about the competence or otherwise of the government?
I think we had an advantage, did we not, which we'll discuss in another session later, that we had some advance warning. Spain, France, Germany, of course, has done extraordinarily well at the moment. So they were hit 2, 3, 4 weeks before us. Mm-hmm. And so I think the The point is that if you've got the juggernaut coming towards you, you can probably step out the way, or at least try and prepare yourself for stepping out the way. And I think that's what I would say in relation to that point, in terms of comparing ourselves with these other great nations. But as I say, we can look at another great nation, Germany, and think, hang on a minute, what did they do differently that we didn't do? And as Joshua hinted, well, the government have prepared for a pandemic, and we'll again touch on that in a later session. There was an Operation Cygnus that took place 4 years ago, which was to tech preparedness, and so all of the paperwork, everything that needed to happen was there. The question came down to whether or not the leadership was there, and that's what we're discussing today.
And Joshua, do you want to respond to that? And I suppose particularly, Nazia kicked off with the question of the UK government preparedness, the question of the lag, having seen, as you've seen, Gregor Woods and others in the chat making the point about the 3 or 4 weeks that the UK had on Italy, but arguably squandered, and then some of the fundamental choices in government through the year, particularly around test and trace, that leads to where we are now. Do you want to address those?
Yes, I'll address them quite shortly, because I know that the next session is going to look particularly at what happened in February, 38 lost days and all that sort of thing. But this simulation in October 2016 that Nazia refers to, it was called Cygnus because it imagined an outbreak of swan flu, an imaginary illness. It involved 950 officials from central and local government, NHS organisations, prisons, local emergency response planners. They were told to imagine they were fighting a pandemic affecting up to 50% of the population. And the report on Operation Cygnus, on that experiment, concluded the UK's preparedness and response in terms of the plans and policies and capability is currently not sufficient to cope with the extreme demands of a severe pandemic that will have a nationwide impact across all sectors. That was sadly true. It's not clear how many of the report's recommendations were followed. Some seem to have been. The government did have some advantage. The problem seems to have been a combination of austerity and Brexit. Planning for a pandemic that might never happen must have been a low priority. And although, the government prepared for this, nobody expects the Spanish Inquisition. Nobody expected the Spanish flu of 1918, and nobody expected COVID-19 in the way it's turned out to be.
And Joshua, where do you, in making the defence of the government, fit a couple of explanations that were given by government ministers, certainly in the early summer? That one was you had to look at the underlying health conditions of the UK population, particularly obesity, and you had to look at the, quote, freedom-loving culture of the British people, i.e. a willingness to move around and, as I interpreted, go to the pub. These two things were very hard to manage, to account for, at least they helped explain. Do you think that is part of the explanation the government would give for what is, if I understand it correctly, still on the high side, the very high side of excess deaths for any European country?
Yes, absolutely. I mean, obesity is a long-term problem. You certainly, wouldn't want to start from here if you're trying to resolve it, to encourage people to eat better. It's a social problem. It's a money problem, poverty. There are all sorts of causes for obesity, but nobody knew until this year, and until quite late on this year, that obesity was associated with morbidity and that it was going to make you more likely to die from this disease. I think that the government's instincts towards freedom-loving people, the feeling that we, the British people, would not want to be locked down, was an understandable and a perfectly reasonable conclusion to reach. It's obviously Boris Johnson's personal approach. It's the approach that the United Kingdom has followed for centuries. You don't have laws unless you need them, and people should do what they wish unless there's a good reason to stop them. Curiously, that was not how people felt, and the government did fail to predict this. You can say with the benefit of hindsight that you might have realized that a lot of people in the first lockdown would have been very frightened, would have been very worried, and were very willing to lock down, were very willing to stay at home, were very willing to try and work from home, were very willing to, go on furlough or whatever it would be with a bit of help from the Treasury in order to try to get the virus under control. We've not seen this in the current lockdown in the way that we did because, well, there are reasons for that. Things change and people have different views. But yes, the government quite reasonably thought people wouldn't want to be told to stay at home and banned from going out and seeing their families. Actually, I think a lot of people were willing to do that.
Okay, Joshua, thank you. I'm gonna come back to you, Nazir, in a moment, but I want to bring in Paul Alborod first. Paul, you're not constrained by either the requirement on Nazir to prosecute the government or on Joshua to defend it. Can you give your judgment on how the UK fared, what you make? And I ask you this, as someone who observes these things and observes the difficulties of making decisions in the face of great uncertainty. I expect that there will be a certain degree of understanding, but how do you see it?
Well, I think, as Joshua says, there was enormous uncertainty at the outset, and because for example, the data from China suggested the death rate might be 3 or 4%, and we know that's much lower now. But at the time, so lockdown was correct initially. I think there were some early, quite major errors, which the benefit of hindsight makes clear. First of all, the borders were kept open. And it does seem now the evidence is overwhelming that closing borders is important to confine a major outbreak. The chief scientific advisor, Patrick Vallance, initially said that mass gatherings didn't really matter. And so Cheltenham Races was allowed to go ahead. A major Liverpool game was allowed to be played against a Spanish team. And these were, if you like, super spreader events. So there were some early errors. I think the government's been badly served by the advice it's received and by the actions of other authorities. I think, for example, to pursue the mass gatherings point, the police allowed tens of thousands of people onto the streets for Black Lives Matter. And that sent a very mixed message. The government was saying that mass gatherings were major spreader events, and yet people could see on their television screens tens of thousands of people marching unchallenged. I think much of the scientific advice has been similar to Project Fear in the Brexit referendum. Most recently, the shambles with the Whitty and Valence charts, saying there'd be 4,000 deaths a day, which is then rapidly revised to only 1,000, and the true number is between 500 and 600. But I think the main failure of the government is not to carry out the standard type of cost-benefit analysis of lockdown, which is routinely applied to all government policies. And the costs of lockdown greatly exceed the benefits. The costs, for example, non-COVID diseases, cancer, hip operations, loneliness, mental health, poverty, child abuse, domestic abuse. And there have been two major studies, one by David Miles of Imperial College, who was a member of the Monetary Policy Committee, did it with some medics at the end of June. And he concluded that the evidence suggests that the costs of continuing severe restrictions in the UK are so great relative to likely benefits that a substantial easing is now warranted. And in late October, finally, SAGE recognized the importance of economic advice and produced a report from Barry McCormick, a former chief economist at the Department of Health, about the costs and benefits of a circuit breaker lockdown. And his conclusion was very clear. The benefits of this are greatly exceeded by the costs they create. And so the government simply hasn't presented a balanced picture we're only presented with the costs and the deaths, and we're not presented with the costs which lockdown itself creates, which, in my view, greatly exceed the benefits.
Paul, forgive me, is it when I've seen these attempts to try and do the quote unquote cost benefit analysis for lockdown versus impacts on the economy, I can understand why the government might be squeamish about that, because you start valuing lives in monetary terms that don't correspond to the way in which most people think of the value of the lives of people they love.
No, I appreciate that, but the government does that all the time. The National Health Service has to do it every day in making decisions in terms of how to allocate resources. But perhaps I could give an everyday example where we all do it implicitly. So, for example, there are just under 2,000 deaths from motor vehicles in the UK every year. And that's of course 2,000 people at random are killed. Mm-hmm. And yet, as a society, we value the benefits of having motor vehicles. We could eliminate those deaths by abolishing motor vehicles, but we don't, because we see the benefits are greater. And I agree, it is rather macabre, but there are standard procedures in place within the National Health Service, which health economists have developed over the years for, if you like, valuing lives. And if you're allocating limited resources, it's something which regrettably, but which simply has to be done. Otherwise, you couldn't make informed and sensible decisions about resource allocation.
Paul, thanks. I want to turn, if I might, to Supriya Garikapati, because Supriya, we just pick up really on where Paul left off. We've had, and we heard from the top, from Nazir, 70,000 excess deaths. I think the numbers are just over 50,000 COVID-19 deaths 28 days after diagnosis, and 63,000 deaths for people who on their death certificate COVID-19 is mentioned. We haven't talked about the economic impacts and how we read that. What's your interpretation of it? First, in the broadest sense, Supriya, in terms of how the UK has fared.
Yeah, I mean, the economic impact has been terrible, isn't it? It seems that there is this false dichotomy between loss of lives and economic losses. Actually, countries that have done better on loss of lives have also seemed to have done better on economic impact. Germany was the first country to open up for competitive sports. We know that New Zealand was the very first country to declare itself virus-free, because we saw early action. Of course, a lot of series of mistakes and miscalculations happened, and some of these are better known by hindsight, but some of these were known at the time. Paul made some really important points about the lack of closure of border and the game at Liverpool. He mentioned the game at Liverpool, which I'd like to pick up. Actually, the mayor of Liverpool, Anderson, knew at the time that it was madness to allow fans from Madrid to travel to Liverpool. And he said no to this. The mayor of Madrid also agreed with this. But the government and the sporting authority, of course, decided to let the game go through. And 3,000 people from Madrid were allowed to travel into Liverpool. And, obviously, we all know what happened with Liverpool in the subsequent months. We had a terrible time with virus in April, May, and later months. And some of those effects probably remain even in the second period. Now, of course, we have mass testing that is bringing hope to Liverpool. The economy of Liverpool has suffered, just like the UK. I don't know where the respite is. One thing that's quite clear is that by eroding our manufacturing base, we have really opened ourselves to the vulnerabilities of supply chain, global supply chains, which have been particularly affected at the time of the pandemic. Everybody was using their manufacturing base to immediately adapt and start manufacturing PPE. And UK simply did not have the capacity to do that. And this is what we know Matt Hancock came to the podium and declared so much. we were scrambling around, trying to buy PPE from all kinds of places. And ultimately, the stuff that did arrive was seen to be not good enough. So by eroding your manufacturing base, you really have, by trying to reach higher and higher up the value chain and the supply chain, you've really damaged your ability to prepare your economy to adapt and respond to this kind of virus. So certainly some mistakes are obvious because of the advantage of hindsight, but some were known then. The local governance was aware of these, but the government simply did not listen. Also, we know that on the 12th of March, when Boris Johnson came and declared that, of course, this pandemic is going to affect a lot of us are going to, our dear ones, some of our dear ones are going to die, and which has been the experience of some people on this panel. At the time then, why did the government decide not to lock down? And even when they decided to lock down, they approached it, with so much lack of decisiveness that it just sent mixed messages. On 16th March, Matt Hancock declared that, recommended that businesses start having their workers work from home. On 21st March, the UK officially declared that businesses should close. And it was only on 23rd that an official lockdown was imposed. So this kind of, toing and froing left people confused, mixed messaging, and all kinds of errors made, some of which at least were obvious at the time.
And Supriya, can I ask you, we started off by talking about the UK's performance by comparison with other countries in Europe. There was another comparison that was widely made, or has been widely made through 2020, which was countries led by men versus countries led by women. And people have pointed to Denmark or Taiwan or Germany, and I know you've done some research into that. What's the analysis of it? How much is it the case that countries led by women have, both in health and economic performance, handled COVID-19 better than those countries led by men?
Yes, thank you for bringing that up, James. Indeed, we find that, when we look at countries led by women and match them to their nearest comparator, male-led countries, female-led countries have done far better. And one of the reasons for this is the early lockdown. They have decisively locked down their countries early. Also, language we found matters. The kind of language that female leaders have used when compared to male leaders has been very different. And perhaps this difference in language evinces citizen compliance. For instance, there is the leader of Ireland who talks about how the pandemic has cost us jobs and has cost economic losses, and then mentions lives, which is very interesting. Whereas the female leader's objective function seems to have been saving lives. And indeed, as I said earlier, it has been proven to be a false dichotomy. Countries that have saved lives have also done better in terms of the economic outcomes. They've opened up sooner and they're back on track, if you like. Why go out into the world? I mean, even within this country, we find the differences in the four nations, and we find that the Scottish government has been extremely consistent with its measures, and consistency and cases seem to be going hand in hand. So there you are. So even within this country, a female leader seems to have been much more consistent. Indeed, if you just travel the border, you'll know that citizen compliance is much higher in Scotland. Everybody is wearing a mask. Even early in summer, people were wearing a mask. People were very careful. So I believe citizens do listen to how leaders talk, to how leaders behave, and to the clarity of the messaging that comes from the leaders.
Supriya, I want to go to David Hayman if I might, but I don't know whether Paul Allmore seemed to be shaking his head. Were you shaking your head, Paul, or were you just?
So in terms of Scotland, we look at the cases. I mean, the reason why cases remain very high in the central belt in Scotland, where most of the population live, and why extra harsh restrictions have to be brought in, is precisely because people are ignoring the rules in a mass way.
Right.
Otherwise, cases would fall sharply, and there wouldn't be a need for Nicola Sturgeon to bring in an extra hard tier 4. So whilst I agree in general with your point, I think Scotland is certainly not a good example in support of your case, not a good example at all.
Paul, thank you. I mean, Supriya, do you want to come back on that?
I could very quickly. I mean, Paul, I'm sure you're aware of the Oxford Policy Response Tracker, which tracks the government's policy response across regions, across countries. And according to that one, we find that the policy response in the country has been most consistent in Scotland. You know how the public health response and the economic support responses are true across the nation. But as far as containment, local containment goes, individual countries are responsible for it. And the Scottish government has been really consistent. We also find consistency in compliance. There is a lot of evidence on that. Yes, of course, cases and deaths, it is a problem, but it is unfortunately one country, the people traveling between countries. And you're right. I mean, Scotland has various other problems because of which Nicola Sturgeon probably has to be more stringent. I accept that. But despite that, I think the consistency in messaging from the leader is an important thing and does evince compliance among citizens.
Supriya, thank you. I want to, if I can, before we get lost, as we might very well do, and quite interestingly in what's happening in the central belt of Scotland, bring in David Heyman, just because, David, I suppose you're in a position better than most to address the point raised by Nazir right at the start, which was one of preparedness and whether or not the UK had taken on board the lessons of SARS and whether or not there is a link between the two.
Thanks, James. Actually, I chair a group at WHO, which is the technical advisory group to the current outbreak. And we meet twice a week for 2 hours and have access to countries around the world that come in and report what they're doing. And so what I'm going to talk about is not specifically the United Kingdom, but in general, what characteristics have shown a good response to date. And that's all written up in an article called Living with COVID, a commentary which is in the Lancet and which is in front of the paywall, so anyone can get a hold of it. It's Living with the COVID Pandemic. What clearly came out in our discussions with countries is that those countries which had a public health voice that was constant, that was not interfered with by politicians, were able to communicate clear messaging throughout the period of time when they were dealing with the outbreak. At the same time, there were no political promises, such as suppressing transmission until a vaccine is available. There were day-to-day communications as to what needed to be done at the day. And clearly, those countries that had major SARS and MERS corona outbreaks were those that were better prepared, and those were the countries in Asia that had been better prepared. We looked at the 3 different country categories, those that have really tried to eliminate the virus, New Zealand, Australia, and we looked at countries that had maintained and sustained their response constantly throughout and had been able to keep business going at the same time. And then we looked at countries that had closed down borders or closed down economies rather, which was not a recommendation of WHO. The countries that were able to detect and respond early in an epidemiological manner were the countries that continued to be able to sustain the outbreak. What do I mean by that? These were countries that had, when the WHO announced on the 5th of January that there was a new disease circulating in China, these were countries that strengthened their detection systems, and linked them immediately to laboratory services that could provide rapid results. So those countries detected early, and by the 20th, 21st of January, we're already identifying outbreaks that were occurring in the country, and we're able to respond to them and shut them down. At the same time, these countries had invested previously in investigation capacity. And so they were investigating the outbreaks as they were doing their contact tracing, looking forward to identify contacts and make sure that community transmission decreased. And at the same time, looking backwards, understanding where transmission was occurring. That was very important to these countries because then they locked down those areas where transmission was occurring, and they didn't do general lockdowns at any time. But what they found in investigating these, and especially Japan was very important in indicating this, was that this was not behaving as influenza. And this was already understood in February and March, when modelers in other countries were still using influenza to model what might occur with this virus. So those countries that detected outbreaks and shut them down early through good epidemiological principles were those that were able to decrease community transmission. At the same time, there were no general lockdowns, and governments mitigated by shutting down major mass gathering events. Those governments shut them down and continued to shut them down, whether it was religious services such as in South Korea or other parts. A couple more important understanding was that local level involvement is indispensable. These governments did not try to manage the response centrally. They provided an environment and the policies that permitted people to understand what to do at the local level. And at the local level, where there is trust from previous contact tracing, for example, for TB or HIV, was where the contact tracing activities were conducted and were successful in doing that. And finally, there's a solidarity in many Asian countries. Asian countries, as many of you know, people in those countries were wearing masks for the last 20 years whenever they had a respiratory infection to prevent others from getting infected. They understood that there was a community responsibility not only to protect themselves, but to protect others by wearing masks. And so those are the general ways in which countries have been able to keep their case fatality ratio low and at the same time continue normal activities as best they could, shutting down and opening up intermittently with precision shutdowns. Thank you.
And David, can I ask you one question in that? Because the point that Joshua Rosenberg made at the beginning, the reminder that on March the 3rd, the government did have a position, this is March the 3rd, and its strategy was contain, delay, research, mitigate. What you said was if you were following the epidemiological logic of things and you appreciated that by then this was not an influenza, it was not behaving like an influenza, is it fair to say that the evidence of February had made that clear?
Countries that began that, yes. I can't tell you whether the evidence, I haven't done a review of all the literature, and I can't tell you that whether the evidence was already being published at that time or whether it was not. And I think that's important because there's been a lot of publication early on about this pandemic, and that's been published in peer-reviewed journals in front of the paywall. So there was access, but I've not myself done the review of that literature in February to see whether or not it would provide that information.
But we're going to come to, in the next session, we're going to talk about, quote unquote, the lost month of February, what happened there. But if I understand you right, if we want to try to give some kind of understanding to whether or not the UK's cost in lives has been outsized and disproportionate, look at those questions of early shutdown of mass events, look at the extent to which it took to heart this idea that it wasn't an influenza, look at, closure to international travel, and look particularly at local interventions, the extent to which local was engaged.
That's correct. And that information is all in the article that I cited earlier. Yes. And you can get that information there. I think there's also been confusion by countries because they're looking at what's reported by the World Health Organization as cases and thinking this is the true incidence in countries, whereas it isn't. It's only based on the number of infections and the testing strategies in those countries.
Right. Well, David, I just want to, if I can, bring in a couple of points that have been made in the chat as we were talking, which I just think are worth raising because they're not necessarily captured by the excess death numbers or even the economic forecasts. If I can, I'd like to bring in Catherine Furnival. I don't know whether Catherine's on a screen or on a phone, but she's just raised the question, or if you like, the next wave of non-COVID related deaths and deaths that aren't necessarily captured in year. Catherine, are you there?
Hi, yes I am. Can you hear me fine?
Yeah, I can hear you well.
Great. Sorry, I'm not on my video. I have a day off work today, so I'm actually just sat in my bed
Good idea. Don't be on video.
Very
Don't
interesting.
Good idea.
So my point really, I just raised a study by Breast Cancer UK, which has found that through the course of the first lockdown, over 1 million women, or just approaching 1 million women, have missed their mammogram breast scans. And what they estimate is that because of that, around 8,600 women will be walking around today in the UK with breast cancer, and they will not be aware and not be receiving treatment. And my point really was that I think we have, or what I have experienced is that there's a view that if you support the government's response and lockdowns and the current kind of policies that are going ahead, then you're a person who cares about other people and you want to save lives. And that if you do not necessarily agree with that approach, or if you question it in some way, then you're considered to not care. And I think really we need to take a more holistic look at healthcare and the fact that preventative things like mammogram scans really do save lives, and not doing those things leads to excess deaths. So I guess that's my point. And of course, that's just one form of cancer in one demographic of people. And I think when we add this up, the costs are really frightening to me.
Yeah. And to take that point, Catherine, in the context of this exercise, which is to try to understand what the cost has been for the UK, the risk is that those people who suffer serious illnesses or die as a result of the decisions made this year may not necessarily be captured in all the data this year. So some of those knock-on effects are something we'll have to think about how we capture. Catherine, thank you, and thanks for joining us on your day off.
Of course.
I also wanted to just hear from Jane Mays as well, because Jane, you made a point about the government's approach to early shielding, and I don't know whether you're there, Jane.
Yes, I'm here.
Hello.
In my pajamas, which is
by the way, that's the way we all
with
work.
washing drying behind me.
I want you to know that underneath, that from the waist down, I'm in my pajamas too. But your point was that the sort of blanket approach to screening could have had an impact too. Can you just talk through what you mean by that?
Well, if you remember, at the beginning, there was an announcement that about 1.5 million people would receive a letter from the GP, which puts them on what's known as the list. And these people they would be expected to die if they contracted COVID, so they weren't going to be treated. Not in an overt way. I mean, what treatment there was at home, GPs' contracts were suspended, which is something I'd like you to cover over the 3 days, what that really means. Home visiting was supposed to continue. I mean, home visiting by medical teams, by what we used to call district teams. But they were not considered to be eligible for hospital or for treatment. And that list then is now, it's about 2 million, I think. Those people were to be sheltered and were to receive a box of food from the government once a week, which in my experience over the period of 12 weeks meant I got 3 boxes.
Right.
Luckily, I wasn't dependent on that. Now, so what I'm saying is, first of all, you take those people out. If to use Catherine's original argument about the average life expectancy and the average age of death from COVID was 84, those people were not the people who were receiving hospital treatment largely. And I don't understand this argument because I don't see what would be any different.
Yes.
So anyway, my thesis really is that this was a kind of pre-triaging, that
Right.
we knew it was to protect the NHS. We know triaging takes place in epidemics and in tragedies like attacks, etc. And I don't want these figures to get lost, or those people to get lost.
Well, just to be clear, Jane, so we're going to have a session
yes.
This afternoon, which is actually on care, which we'll deal with. I hadn't heard the phrase pre-triaging, but
I think I invented it.
Come back. Okay, good. Well, there it is. It's now enjoy the language. It's been a year for new words.
Yes.
Jane, I'm going to, if I can, come now to I sort of call him a sort of comrade in arms, Ed Conway, and ask Ed. The one element of this conversation that we haven't really delved deeply into, Ed, is the extent to which we think it is fair to say that the UK has performed much worse economically. And I wonder whether or not you feel as though we can make a sensible judgment on the UK's economic performance yet.
I think that's a really good point, and it goes wider as well. I mean, specifically in the economics at the moment, as I think Nazir said, when you look at the OECD numbers, it's pretty bad for the UK. We're one of the worst in the developed world. But then again, if you look at the latest IMF forecasts for this year alone, then you're talking about the UK being down by about kind of 10%ish, and then same as France, more or less. Spain is down by more. Italy is down by more, and also look at India. India is down by far more, about 10.3%, and compare that with what previous growth rates of around 6%. That's even more. But as you say, it's I think it's too early to be definitive about that. And in a way, this is one of the things about this inquiry and why it's important to do it, obviously, and that's why we're doing. Trying to take a similar look at Sky in the new year, and we'll be hopefully kind of talking to each other about that. But many inquiries are kind of in a sense about closure.
Yes.
We're not really at that point yet. Clearly, that this is still an ongoing pandemic. Things have changed, and the wonderful news about vaccines over the past few weeks does change the argument and swing that argument about lockdown certainly in one direction. Now that's a far stronger argument that you lock down and wait for the vaccine, because we have vaccines that might well be oncoming in the next few months.
But can I ask you, can we even at this stage begin to say we can say some solid things about performance on health. We can give excess death numbers or COVID death numbers. On the economy, can we say, look, this is where the UK has landed in 2020 by comparison with other OECD or developed economies, and also within the UK, can we begin to say some things that are concrete about the impact of these lockdowns on particular places and communities?
I think it's still too early, to be honest with you. I really do, and I think that. Okay, so take a couple of more the kind of imponderables. To what extent does this experience, like World War II, kind of stimulate investment that otherwise wouldn't have happened? Now, we talked a lot about the economic negatives, and they're pretty clear from those numbers. Like you say, it'll take a while before we see 2021 and future numbers. But to what extent, does the investment generate innovations that wouldn't have otherwise happened? So, here we are all working remotely. To what extent does that cause a change in globalization? We don't know. We actually just don't know. And it could be positive. It could otherwise, and it could be good for countries like the UK. It could be worse for countries like the UK. But to what extent does having the first mRNA vaccine in humans mean that we're at the beginning of the new period of innovation? Have policies like the furlough scheme, this is another imponderable I think about a lot, but I don't think there's an answer to. The UK has a very open labour market. We've had to impose a policy that we've never had before, the government paying people's wages temporarily. To what extent does that change the nature of the labour market? To what extent does it change the regional distribution of the economy? those are really interesting questions, which we're only beginning to think about now, in the same way that, you know, like Catherine was saying, and like many of the contributors have been saying, there are questions that go far beyond COVID deaths here. You know, deaths at home are still incredibly high. You know, they even were during the summer when lockdown had ended. To what extent does that have an impact on public health or elsewhere? And that's kind of before you get to these fascinating questions that have been raised along the way about public policy, about the nature of supply chains that Supriya was talking about, the nature of data management Paul was talking about, you know, data and slides, transparency, which David was talking about. You know, we haven't necessarily been particularly good when it comes to the transparency of the way that scientific research has been provided by Sage and other people here. I don't know the extent to which that's made a difference, but that does need to be scrutinized. So that's really the point here. This is not going to be a moment of closure for us, but things are starting to crystallize. And I think the nature of the questions that we're able to ask at this stage are at least better questions than they were 9 months ago, even if the answers are still inchoate and kind of getting there.
It's so interesting. I hadn't expected to think that, but just listening to you, that the possibility is you're not able to come out with a hard and fast, oh look, the UK's performance economically has been X% worse than most other developed economies. But it does suggest to me, Ed, that you will come away from this saying this particular part of the economy has been terribly badly hit versus that part of the economy, which may have seen some, you know, reasons for revitalization, and that will happen for parts of society and also the geography of the country too. It will surely happen in that sense.
Yes, I think that's right, and I think, you know, this is a ripe moment for having that conversation, you know, in the UK and elsewhere, particularly in the UK. You know, with so much talk about levelling up. Well, this kind of raises that even to an even greater level, and I think then there's the deeper issue, which is that, you know, we are in the process of spending so much. Let me give you kind of one example. The Channel Tunnel at the time that it was made cost £9 billion, and, you know, inflation adjusted, that's kind of getting towards 20 billion pounds or so. Crossrail will end up costing about £20 billion, hopefully. Put those two things together, it's about £40 billion. Well, £40 billion is precisely the amount, actually £42 billion is precisely the amount we're supposed to be spending on mass testing. So mass testing for COVID-19 will be more expensive than the two biggest rail projects, enormous rail projects, transformational, both for, you know, for transport, but also for parts of the economy that they affect. And the same will go for HS2. Those are kind of big, you know, big issues, big numbers, and it's worth us pondering those as well.
Well, Ed, thank you. I'm going to, the next session starts at 9:15, and we're going to look in particular at February. I'm going to just come back to, if I might, Joshua and Nazir, just whether you had any closing points. Nazir first, on what this conversation has done in terms of the overall case on the UK, and then I'm going to allow Joshua to have a final word and then wrap up.
James, I think one of the things that came out of the conversations we've just been hearing is the government's failing on preparedness. Up to now, we've been talking about PPE not being available, and that's been but you've heard over the last hour, for example, we weren't prepared for how do we deal with breast cancer screening? How would we deal with all the other underlying health issues that people need addressing? We built Nightingale hospitals, but we didn't have any staff for them. We talked about the inability of having community testing. There was no community testing in March, and that was one of the reasons that drove the need to have lockdown later than it did, and one of the reasons why my brother couldn't get tested prior to his death. And we've compared ourselves with Japan and Germany, but why not compare ourselves with Africa? Africa, which we don't often think of as a place with strong economies, etc. But because they've been prepared for Ebola, SARS, AIDS, etc., they have some phenomenal public health screening. We didn't even look at them and what they were doing. And so the issue for me is we can talk, and we have talked about the government's failings, in my view, over the last 8 months or so. But prior to March, And during this period, they could have done so much more. And I think Joshua mentioned Brexit austerity almost like a throwaway. They were both government choices.
Yeah.
And the way they were handled were government choices. So I do not forgive them, I'm afraid, for saying that's the reason why they couldn't do what they should have done.
Joshua.
Just in a sentence, Nazir is absolutely right. Brexit and austerity were government choices. What the government was not expecting was this crisis. And it just did the best it could. It did not do as well as people would have wanted. It did not do as well as it should. We can talk about leadership in the next session. But these things are very, very difficult. And if people are not properly prepared for them, and nobody was really prepared, and the UK was not prepared, certainly, these things are difficult. And people are well-meaning, they do the best they can, things go wrong, and they try to make amends. But these things are sent to test us.
Joshua, thank you. Well, what's sent to test you next is a discussion at 9:15 on this critical question of what happened in February. And just for everyone who's joined us and been kind enough to give their time this morning, I just want to have 1 minute just to talk about the process here. What we're going to try to do is produce in the middle of March a full narrative of 2020. As I said at the beginning, it's not a judicial review, it's not a public inquiry, it's not, claiming to make recommendations on how government should work. It is an attempt to try and see the wood for the trees. It is an attempt to try and understand what really happened. And so I wanted to be clear that the contributions that you're making in the conversation we have, in the way that Catherine and Jane did, but also in the submissions in the chat, incredibly valuable. So whether it's David Heyman saying, look to this article in the Lancet, or I saw that Simon Briscoe just made a point that I hadn't heard before, which is around the way in which the ONS has accounted for the public sector in the second quarter. We'll make sure to follow up on all of those things. Likewise, some of those challenges are around what we're not seeing or not counting. Catherine Furnival's point about breast cancer, we followed up, as you could see, my colleague Tom Goulding picked up the screening data, which is really important. But when David Mapstone challenges the direction of travel in the conversation, i.e. female leadership, causation versus correlation, we're going to want to make sure we pick up on that too. So this exercise is that classic journalistic exercise of gathering as much string as possible. I hope that it will end up delivering something that we can thread together in a full story of 2020. For now, can I just say a huge thank you from the start. It's been really helpful to get a sense of the scale of what happened, and actually just listening to Nazir at the top, listening to the scale of what's happened in terms of deaths and impact. It's also really valuable, Joshua, to get that corrective, that view from the government. So thank you, but a particular thank you in this very first session to David Heyman, to Paul Ormerod, to Supriya Garaklapati for joining us, and of course to Ed Conway from Sky. Thank you all. We will see you in 5 minutes at 9:15 to answer the question, what happened to February? Thanks so much.